These buildings never close. Here, someone's on duty all the time. People work 24 hours a day, 7 days a week, 52 weeks a year. Here, the boiler room fire has never gone out in over a century. But that's about to change. For these three hospitals, Middlesbrough General, North Riding Infirmary, and the rehabilitation unit at West Lane are shortly to close, and their staff move to new purpose-built facilities at the James Cook University Hospital.
He's got a dislocation of the joint here. He's injured his hand and dislocated the bone from the joint here.
When that happens, a link that's existed for over 120 years will be broken. A link that stretches back into a proud industrial past.
We must put these hospitals in the context of the community in which they are. Middlesbrough was central to the Industrial Revolution. The town grew from 40 people in 1830 to over 100,000 people by 1901. And these hospitals were built as a direct response to that growth. The most important part about a hospital, of course, is the staff you have, the people that work for you, the people who look after the people of this area. And I'm immensely proud of their achievements in the past, and I'm sure I'm going to be proud of the achievements in the future.
How are you doing, sir?
Doing fine.
Right.
Can you lend me a fiver?
A hospital is a complex operation, drawing on a huge range of skills. They include specialist doctors, nurses, consultants, and a battery of administrative staff. But because a hospital is in effect a small village, you find people delivering the post, making the meals, maintaining the buildings, and tending the gardens, and much more besides. And it's not only the paid staff we're talking about. Behind them, and integral to the work of the hospitals, is a small army of volunteers.
The work of the voluntary services in the hospital is so important because they raise funding, and it's something of over $1 million a year. But on top of that, they're always about the hospital, and they go into wards, and they've got time to speak to people. And so that is a great boost for the work of the hospital.
Thank you very much.
I was bred in Teesside. I've been here all my life, and so always want the best for the people of Teesside. And I think in these hospitals, we've had the best.
The quality of the service provided in these hospitals is as good as you'll find anywhere. But 100 years down the road, the buildings are showing their age. And over the years, the hospitals have seen enormous changes. Once, Middlesbrough Workhouse formed part of the General Hospital complex, and it was only demolished 20-odd years ago. In the 1930s, patients were still placed in Nightingale wards, and even the operating theatre and X-ray departments of that time looked like museum pieces. After the Second World War came hydrotherapy baths in the 1960s, and a physiotherapy training room a decade later. In their time, they represented great advances, but few would deny that the buildings housing the current facilities are well past their sell-by date. So in the summer of 2003, these buildings will close, and it'll be the end of an era.
There will be some sadness in leaving these hospitals. The staff that are in the hospitals see them as little villages, and they work as a community within the hospital, and they'll find that difficult in some cases. But the opportunity for the new hospital is absolutely enormous. It will be one of the best hospitals in Europe, and the opportunities for the staff and the patients there are absolutely unlimited, and we are looking forward to that enormously.
Many people have their first contact with Middlesbrough General in a way they'd rather not, by being admitted to the accident and emergency department. This is where the people of Teesside meet the hospital professionals. This Wednesday afternoon, Clinical Director Mr. Chi Han is in charge.
The first thing is the unpredictability. Secondly, the excitement, and the patients who come through resus, patients who are quite ill on trolleys. We do really have the satisfaction of doing something quick, fast, effective for them, and we really help them on the way to recovery, and that is a buzz. On the other end, you've got the trivia, and one might think that, you know, it's only trivial injuries or illnesses. What is so satisfying about it? But for the patient, it is very different. For us, it might be trivia, but for them, it's a sprained ankle which will take them out of work for 6 weeks. It's a significant injury for the patient. And if we can really deal with that kind of a sprained ankle, a crushed toe, a fractured wrist effectively, see them recover either in our clinic or in the orthopedic clinics, again, it's a very gratifying thing for me.
Today brings a typical selection of problems. But A&E doesn't only provide medical care. It also offers something equally as important, a sympathetic ear.
I was just going into the bathroom and I just can't really remember. I just kind of faintly felt as though I was going to fall, and that was that. I was in quite a bit of pain and that, trying to struggle to get up and crawling along the path.
I'm going to put this bit on now. It's going to be a bit heavy. I feel a bit warm as well.
I had the warden control bell on, so I pressed that. And within about 20 minutes they were there, like, then they got the ambulance. It's broken, I think, isn't it?
It is, yeah, she's broken her wrist. This is just a temporary one that you've got on today, okay, just in case it swells up anymore.
Oh.
There's a gap down the back here. All right, if it swells up, it'll expand. You'll be seen again by an orthopaedic doctor within the next few days. All right. And they'll sort you out from there.
Hospitals can be intimidating places for all of us, but especially so for young children. At the General's Accident and Emergency Department, a special children's area is designed to provide reassurance. Unfortunately, young Emma's too upset to notice. Dr. Graham Croft, a local GP, is working here.
I think the best thing to do, she's in a lot of discomfort. So what I'll do is I'll try some pain relief now, some medicine to give her some pain relief. We'll get an x-ray.
She's got an elbow injury, left elbow injury, and as you can see, she's very distressed. Looking at it externally is difficult to examine her fully, so doctor has just prescribed painkillers to start off with, and we'll x-ray her first before we re-examine the child.
Because you sat still, didn't you? Should we put it on your t-shirt?
There's one sticker.
Right, that's the left elbow x-ray, and everything seems to be satisfactory in that there's no fluid inside the joint and I can't see a break. So it's fairly certain what this little girl has is a pulled elbow, which is a dislocation of a minor joint in the elbow, and I'm sure Dr. Croft will be able to click that back into position. 90 degrees. 90 degrees.
He went and felt it.
Did you?
Yeah.
Right, that's it. Excellent. There you go.
That's it. That's it. That's it.
Emma's elbow has been clicked back into place so quickly that she and her worried mum haven't yet realised.
She's a lot better, but I don't think she agrees with us just yet. So we'll let her play for 5 or 10 minutes and you'll see she'll calm down nicely and start using it.
Yeah, I'm better.
The workload of accident and emergency is unpredictable, but it's seldom quiet. Next to it, at the General, is Radiology, a department that works closely with A&E, but also deals with regular, routine appointments.
Radiology is about taking x-rays and making diagnosis. It's a diagnostic department, and there are lots of different areas linked into that.
Carol Jackson is supported by a committed team. Jeanette Weschenfelder is one of them.
Casey Harrison, please.
She identifies strongly with the work and her role in the team.
If a child comes round and they've broken the wrist and they're really distressed, and you do the x-ray, you feel as though you've done something.
Really achieved it, yeah.
You help them, and then they're going to go around you. If you've said yes, it's broken, and they go around and have a plaster put on it, and then you'll see them again a bit later on around here, maybe in another week, and they'll see you and they'll think, oh yes. Right, I want you to sit on the stool so you're facing that way, okay? That's lovely. And can you just take your sling off for me? Just pop this on your lap. You just hold on to that with that good wrist, okay? That's lovely. Okay, just hold nice and still for me.
I'm off my bike at Flats Lane. I was coming down the hill and I was going too fast and I just crashed into a bump at the end.
We do 2 x-rays of her wrist, and then we'll see whether it's healing or not. And she'll take those x-rays back round to the doctor, and he'll have a look and decide whether she needs another pot on or not. Another plaster cast, that is. We call them pots.
Katie can be pleased with progress. The X-ray shows her fracture is healing. There's another aspect of radiology, also found at Middlesbrough General. Neuro-radiology, which undertakes brain scans. People can find themselves having a CT scan for many reasons.
I was phoning a friend, and while I was talking to this friend, I got violent headaches from the top of my head right down, actually right into my shoulders. It was a very, very bad one. I've never experienced anything like it in my life before.
CT scans can be a mysterious, sometimes frightening experience. Richard Bohr is keen to demystify the process.
I was going to start moving now, okay? Nice and still there. A CT scan is very similar to an X-ray. It's based on the same technology as X-rays, except it has a computer working out the pictures for you. Blood shows up differently to brain. You come in, you lie on the table, and the computer will essentially take slices, just like a bacon slicer. You produce bacon slices through your head, and then you can look and see if there's any blood where blood shouldn't be. And relax just there. Okay, sir, that's all finished. All right, it'll just take a little while to get the pictures out of the machine. It's got all the data, it has to print the pictures. Then we'll show that to one of our consultants, and he'll report that for you.
Yeah.
There's another diagnostic area at the General, and one that in the public's mind at least has got a less attractive image. Chief of Service John Drury runs the Pathology department. He's happy to put the record straight.
The vast majority of the work in any pathology laboratory these days basically helping doctors and helping support doctors in making diagnoses and monitoring treatment. A very small part of the activity of a few people. For instance, out of 150 staff that work in total in pathology, only 20 work within histopathology, and it's only the consultant histopathologists that perform post-mortems, and there are 6 of those. Obviously, some common problems, fractures and that, the test is an X-ray. For some conditions, you can tell what's wrong with a person from clinical examination with a stethoscope or looking at a particular part of the body. But for illnesses which involve internal organs of the body, the kidneys, the liver, we don't have a perception. We don't get up and say, oh, my spleen's having a good day, or, you know, my liver's happy. Very little of the work is the popular image of pathology. Most of it is quite high volumes of simple blood tests. And when you next go to your general practitioner and a blood sample's taken, it's this department around here that it's come to.
Tests and diagnoses are an important part of the hospital's work, but they all relate to specific patients with real concerns. People look to the hospital staff for reassurance and support. Joanne Barker is working in A&E and finds this aspect of patient care emotionally challenging.
So sometimes you do get personally involved. You can't help it really when it's something traumatic and when it's a tragic story. But obviously we have to try and act as professional as we can. And sometimes you're acting so much on the sort of medical side of thing that you don't let yourself feel as much as you should, you know, as a human, really, I think sometimes. But then when you go home, you can reflect on it, and sometimes that's when things come flooding back to you.
Are we in colour?
Keith McIndoe was out shopping in the Middlesbrough centre when he suddenly had difficulty breathing and was brought in by ambulance. As Joanne starts her examination, she's well aware that every patient is different.
He's a 78-year-old gentleman who has come in with shortness of breath. He felt it come on when he was in the taxi after he'd been running around quite a bit. We haven't got any old notes on him, so really we have to go on what he tells us. At the moment he's quite stable, but he's got a bit of a fast heart rate, so I've done some bloods on him. We're going to send him for a chest x-ray. The most likely things that I'm thinking of is maybe he's got an infection which has made him short of breath, or also possibly he might have a clot which is making his heart rate fast as well. So we need to exclude those things. We're going to admit him under the medical team.
The cornerstones of any hospital are the inpatient wards, and Ward 41 is typical.
Morning.
Good morning.
How are you this morning?
Well, I'm a lot better than I was.
You're managing okay there?
Nicola Lipscomb is on duty today. She's been here for 9 years and deliberately opted for this sort of work.
This ward is the orthopaedic admissions ward. We take patients directly from A&E department, generally anyone who's had a road traffic accident or a fall at home. It's a short stay ward, and we transfer patients to the other orthopaedic wards for rehabilitation after they've been on here. We also take patients from the accident and emergency department who need neuro observations or who've had a chest injury, and we also have a 7-bedded day unit on here.
This is your head end.
Is that the head end?
That's the head end, yes.
Sorry.
It's a busy atmosphere, obviously because of the nature of the work. It's a fast turnover ward. You never know what's going to come through the door, what sort of a day you're going to have. It's very exciting.
During the day, there are few quiet moments on the ward. Doctors and consultants do their rounds, tests and medicines need to be administered. But there's also a daily routine that includes cleaning and the delivery of meals. Staff like Anne form the bedrock of this service.
You meet lots of different people. You know, you've got men and women and young and old, so it's a good place, and the staff are brilliant as well, so lovely to work for.
Tea or coffee?
I'll have coffee, please.
Sugar?
No, thanks.
No. When it's a bit quiet as well, you get a chance to talk to them. As long as you keep your work going. Work and talk at the same time.
In the course of a day, there are many visitors to Ward 41. One of these is the Reverend Philip Carrington, who after a successful career in industry was ordained and became the hospital chaplain in 1992. He heads up a team of clergy and lay people, and he's a man who enjoys his work.
They said particularly you had to be in at that time this morning, right? Same for yourself?
Yeah, exactly. Yeah.
Hospitals are not pleasant places. They're full of poorly people, full of traumatised people. And to be able to find an oasis, a sanctuary, a place of peace and quiet, this place is. When I stop talking, you'll hear just how peaceful it is. The walls themselves absorb all your fears, worries, anxieties, and bounce back with a wonderful personal peace.
That personal peace can be especially important to patients facing major surgery. People like Sally Turner.
This morning I'm going to have a complete left hip replacement done by Mr. Anderson. This is the second hip replacement I've had. I had my right hip done 4.5 years ago. It is very important. I haven't been able to do what I want to do. I can't go down in the woods, I can't go down on the beach. I can get down, I can't get back up again.
There you go, Sally. See you after there.
Yeah.
Okay. Bye-bye.
I feel that when you're anaesthetised, you're not in control, but you have to be, or you couldn't have the operation. Well, you could have the operation, but it would be extremely painful.
Just a sharp scratch, back of your hand. Oh, this is a bit. Nearly 70 or 80% of the patients that I have seen personally, they are concerned about, that they are scared of going off to sleep. Rather than actually having the surgery done, they are not that bothered about the surgery. They're scared of going off to sleep. And whenever we ask them, or I personally, when I ask them, that if they've had any problems, if they know of someone who's had problems going off to sleep, they say, no, it's just that, it's just the fear of losing control, that's what they're scared of.
Take some nice big breaths for us. That's it.
The original hips were metal heads and plastic cups. Now metal's harder than plastic and it wears it out over the years. There's a newer generation of prostheses now which are covered with biological materials that the bone doesn't recognize and the bone grows into it. Now the advantages of that is that A, you don't damage the bone putting cement in, and B, they should last longer because they become virtually part of the body. I've been doing these for about 12 years now and they've been very successful. I've been very pleased with them. I chose to do that on this lady. She's got good quality bone and she's normally fit and active. And if you see, I'm actually moving the patient. I think it's very important to actually see the patients when they come into the anaesthetic room because that makes them feel relaxed. They suddenly see somebody they know. And so that's an important bit of the surgery. Plus, of course, it's very safe because you can actually check again on which side you're operating on. Because believe me, somewhere in the world every day, several patients have the wrong side opened up or closed. So I think it's very important to go in and speak to the patient and just check that you've got the correct side. And it's looking good. You can see the new joint in there now. The head's in the socket. And we give it a move around, moving nice and smoothly. But somebody comes to see you who can hardly walk across the room, and you put them a new joint in their hip or the knee, and when you see them in 6 weeks' time, they're walking across the room as well as you are. And that gives one a tremendous amount of satisfaction.
They'll have me walking with a Zimmer frame in a couple of days' time. And then, hopefully, everything will be fine.
There's no questioning the dedication of the staff at these hospitals. They're all highly skilled and they provide outstanding care for patients on Teesside and beyond. That's an achievement that gives Chief Executive Bill Murray much pleasure.
What I'm going to go do, I'm going to go get my little white card and write your name in that down. I'm going to take this jumper off.
It's marvellous that this hospital, 125 years of age, now can deliver modern medicine, and it does deliver some fantastic medicine here. But I'm sure the Victorians, when they built it in sort of 1870, didn't expect it to be here in 2000.
It's been Bill Murray's task to oversee the creation of a new centrally based hospital system in Middlesbrough, one he believes will provide the 21st century infrastructure his staff deserves.
James Cook will have every specialty that the NHS needs in acute care on the one site. Now, you can understand how the advantage that is to doctors being able to deliver the very best care to patients. We're providing those specialist services where a lot of our patients here will have serious complaints, serious illnesses. So it's important that we provide a very personal service to them. We've got to realise, each and every one of us here, that there for the grace of God go I. Often we talk about the NHS using large numbers. It isn't. It's a lot of individuals, usually very frightened, usually terrified about what's going to happen in the future and wanting, first instance, support. Someone to metaphorically put their arm around them and say, it's all right, you're here, we'll help you. So at the heart of our service is helping people, but then using the technology, the expertise to really hit the diseases as hard as we can.
Shortly, all the Middlesbrough services provided by South Tees Hospital's NHS Trust will be situated under one roof, with benefits for everyone. Currently, eye casualty is housed at the North Riding Infirmary on the northern side of Middlesbrough.
You look on right, please.
Charge nurse Trevor Knowles leads the team today.
Oh, what you been doing to yourself?
I've been doing some wallpaper stripping, and I've pulled the wallpaper off the ceiling and it's gone into my eye last night.
Okay.
It's just causing like a burning sensation.
Okay, have you washed it out at all?
Yes, I've tried Optrix and rinsed it out with warm water, and I can just feel it as I'm moving my eyelid, you know, my eyeball.
Yeah.
Side to side I can feel it.
If you cover your right eye for me, please. Through the mirror there, if you can read me the lowest clear line you can see on the lit up chart.
U-H-A-N-T-W-Y-O.
And try the other eye for me.
Bit blurry, like. U-H-A-N-T-W-Y-O.
When the patient comes in, they're frightened. And we've all had specialist training. We've got quite a lot of years of experience between us, and it probably runs into triple figures. If you feel that you can reassure a patient, get them calmed down, treat them, or know that the person who they're going to see is going to treat them properly, then it's quite nice to actually deal with so small an organ and get it sorted out for them.
Will you be able to see the object if there's a object in?
Yep.
Good.
Go under me little microscope here. Right, if you bring your forehead forward just until you touch that bar there. Okay. And just look straight ahead for me. There was something stuck on the white of your eye. Very possibly it's a piece of soggy paper that's gone on.
That was paint on. Yeah, it just feels like something in it now. Is that how it would normally feel?
Because I've been messing about with it, yeah.
It's like here, you know, it's the top, like the eyelid.
I think what we'll do is we'll get the doctor to have a look. Okay. Because it's a small hospital, it's got a better atmosphere. Staff know everybody, you know, everybody knows everybody else, basically. And you get to know if people have problems, and there's always somebody there with a, you know, good word for everybody, arm round the shoulder job. And we deal with our own problems most of the time. So it's a good place.
North Riding Infirmary is also home to audiology services.
My name's Karen Moody. I'm the audiologist, and I'll test your hearing today, and we'll fully reassess your hearing aid and see if we can provide you with something a little bit better, okay? So if you'd like to follow me round to the testing room, we'll test your hearing, okay?
It's a department that thrives on innovation. The first in Britain to test hearing and manufacture the aids patients require on-site in its own workshops.
It's a unique place to work, and the team itself is very well organised. We all get on very, very well. I think that creates a better service for the patients. You know, the care we provide, I think, is second to none. We'll pop these headphones on.
Oh, my glasses in the way, dear.
No, they're okay, don't worry, not yet.
Doris Marshall thinks her present aid needs a bit of attention, so Cadden is conducting a new hearing test for her.
I think within audiology you see such a change from a person hearing nothing, being in an isolated environment, to essentially fitting a hearing aid up and giving them a new lease of life, and that's kind of what attracted me to this role.
That's a different sound.
That's it. So, okay, it will change pitch, but any sound at all, press the button.
It's very slight.
It's okay. Well done. Okay, nearly finished. The last time you had your hearing checked was in 1999, and there has been a slight drop since that time. It's only by about 5 or 10 decibels, which isn't significant. It's probably just more due to the fact that it's been 3 years since your last hearing test. Now,
in fact, Doris's hearing has altered only slightly. But nevertheless, Cadden decides a new hearing aid will help. And that's when the benefits of this integrated department offer a real advantage. Des Robertshaw is the principal audiologist.
The main reason for doing it was to be able to provide our patients with a choice of differing styles of hearing aids. At the time, the only hearing aids that were available under the National Health Service were the old-fashioned behind-the-ear type. And a lot of our patients are saying to us, we'd very much like the in-the-ear design, but they cost a lot of money because the only way we can get them is to go privately. There are two laboratories upstairs. The first room, the acrylics laboratory, is where we take the silicone casts taken of each individual patient's ear, the acrylic shell in which the electronics for the prescription in-ear hearing aids are going to be made. The second laboratory that you see is for just that. It's for loading the electronics into the individual hearing aids and for testing the performance of those electronics. At the end of the day, I think we've ended up with not just the service that the patients wanted in terms of getting the all-in-the-ear style, but we've actually ended up learning an awful lot about hearing aid prescription and hearing aid performance, which has enabled us to provide better acoustic performance, better hearing performance, in other words, for the patients that we're providing the hearing aids for.
Okay, that's set there, so I'm just going to remove this. That's lovely. And you can see that it's just taken the shape of your ear.
Yeah.
And that's where the hearing aid will stop there, okay?
There's one place we've not yet visited, and one department that offers dedicated long-term support and rehabilitation. At West Lane Hospital, you'll find the Trust's Neuro-rehabilitation Centre. Here, patients follow intensive physiotherapy programmes and learn how to adapt so they can once again cope with life outside the hospital. The physiotherapy clinical team leader for neurosciences is Judy Purton, and her aim is to make patients feel at home.
Well, we try to make it as relaxed as possible because a lot of the patients are here for a long time because of the nature of the problems that they've got, and they're here for long-term rehab. So we try to make it as informal and as friendly and relaxed. So, for instance, in physio we'll have the radio on and, you know, everybody's on first name terms.
Yeah, okay, Les.
Off you go. Just see what that's like, because it might be...
Oh, yeah. I have it on next to nothing.
Next to nothing.
Next to nothing.
Well, it's on next to nothing there, but that's too easy. You can turn it up.
Yeah.
All right.
I start off slow, you know.
We work quite well as a team. The therapists and the nurses, we keep in close contact with each other, and, you know, the nurses are in and out of the department, we're on and off the ward. So we communicate very well about what's happening with the patients. Personally, I think we have a good team here. There's a good atmosphere. We're supportive of one another. Les has had surgery on his neck, and it was quite complicated surgery, and the bones in his neck, because he's elderly and he's got arthritis, were very sort of thin and fragile. So after the surgery, he's had to have this big halo frame on.
Well, with being in bed for 2 or 3 months, I had a lot of muscle wastage. So now we're building up the muscles on my legs to make sure that I'm able to walk a lot more distance. It's all right. You get used to it, really. I sleep all right as well, funnily enough. Yeah, once you get used to it, yeah. It'll feel very strange when I get taken off.
Because of the damage in his neck, it's affected some of the nerves to his throat, so he has problems with his swallow, so he can't swallow, and I think it's unlikely that he ever will be able to eat and swallow. So he has a tube in his nose going down into his stomach, and he's fed that way. Where they get the resources from to cope with things often amazes me. And I mean, he's very positive, he's very upbeat, and I don't know how I would feel if I knew I was never going to be able to eat again. But he just takes it in his stride.
Therapy can take many forms. Dr. Don Breekins, a neuropsychologist, and today he's accompanied on his rounds by his specially trained dog, Tilly.
We brought her onto the ward as a puppy, really to provide a bit of extra stimulation and excitement, really, because if you're in hospital for a long period of time, as people often are on a rehab ward, the sort of days run into one another. So she came here very regularly, 1 day a week, so it's just saying hello to patients, really. Tilly, you can come this way. Yes, you love the camera, don't you? So, yeah, this is Tilly. She's just come around to say hello. Would you like to have a stroke? Lily, come this way. You can say hello. Come on up, you can. I don't think Rebecca can reach down that far. Is it Rebecca? No. I think if you work in a rehab team, there is a different kind of atmosphere. You're working towards longer-term goals, and there's a common. Everyone's got a common purpose in that regard. She gets the odd treat.
The three hospitals, West Lane, Middlesbrough General and North Riding, have done Teesside proud. They've provided a wide range of facilities, from accident and emergency to orthopaedics. And as everyone prepares for the imminent move to the James Cook University Hospital, Bill Murray is convinced that this is the right moment to both celebrate the achievements of successive generations of dedicated staff and also to offer them the very best facilities in which to work.
We can't close. I mean, we have breakdowns, but it's every hand to the pumps to make sure that we're back online immediately. We genuinely cannot close. So if you think back, and it fascinates me because I'm an engineer by profession, that back in 1870 they would light the boilers here. There would no doubt be shoveling coal or coke onto the fires here. But that fire has never gone out. 125 years of energy being flowing around this hospital every day, 24 hours a day, 365 days of the year.
And that's really the end of this chapter, but it's the start of a new one. The James Cook University Hospital means that South Tees Hospital's NHS Trust can look forward to serving the people of Teesside and beyond for another 100 years.